We are starting this half hour by talking about an issue that has become more meaningful for a lot of people through the pandemic: mental health. There is no end date for the spread of COVID-19, and that's taken a real toll on a lot of our nerves. Anxiety, stress, and depression seem to be at all-time highs. Today, new bills to improve access to mental health services were introduced in Augusta. News Center Maine's Sam Rogers has the details.
Our behavioral health system is in crisis.
It's a topic these lawmakers have heard before.
We've seen a 20% increase in the number of client visits each week compared to the time prior to the pandemic.
Members of the public briefed the state's Legislative Committee on Health and Human Services about Maine's current mental health crisis.
Many patients prefer to receive their services by telehealth.
State Representative Colleen Madigan introduced two bills to address the crisis Tuesday. LD 1758 aims to allow Mainers to access telehealth services without written consent. Instead, allow for verbal or electronic consent during public health emergencies.
This is sort of how technology can help us serve people in rural areas or in bad weather.
During the public hearing, Ann Sedlak, representing Teladoc Health, said more than 2,200 employers provide these services in Maine, which covers 138,000 people.
It saved Mainers an average cost of $472 per visit.
Next on the agenda, LD 1848, which looks to increase the availability of assertive community treatment services, a response team that responds to mental health or substance abuse crisis calls.
It just expands the definition of who ACT teams can employ to prescribe psychiatric medication.
Madigan has firsthand experience on this matter,
because I used to work on an ACT team right in Augusta, Maine.
The bill introduced at a crucial time.
There's a shortage of psychiatrists in Maine and nationally. This is only anticipated to worsen.
The legislation would allow other qualified health professionals to join these response teams that work a 24-hour, 7-day-a-week job.
You can pay for it one way or you can pay for it another way.
Madigan explains investing in these services now can help keep Mainers in need off the streets and out of jail. Sam Rogers, News Center, Maine.